Hi there, my name is Megan. Thanks for joining us here at Dove. We are going to be talking today a little bit about our process for taking histories when clients are checking in to our hospital, either for scheduled appointments where we might have a little bit of background, especially if this is a returning patient, or for first-time patients that are coming in on an emergency basis without any warning. All right, so it's important to differentiate between a history and the initial triage when a patient is coming into your care. So the initial triage is going to be kind of that first contact, and it may be the same person, the same employee who's doing the triage as will take the history. So the initial triage, who are you, why are you here, what's going on? If you at any point feel that the nature of this visit is critical, don't ever hesitate to go and get a second opinion or to bring that patient back to the doctors and the nurses that are waiting in your treatment room there. We always want to prioritize patient care first, and we can loop back and talk about the history and any of those different questions like vaccine status and medications with the clients after we prioritize that patient care. When I'm having that conversation with clients, that's something that I do daily, dozens of times a day in our ER here. I have a little spiel that I have for that, where I will tell the clients, okay, I want to get him checked out by a doctor and just make sure that he's okay right now. I'm going to come back in a couple minutes and we'll go over some of those bigger picture questions about his history, but we'll be right back. We have been really successful with having templated history forms, and you can have several different types of history forms templated for your use, and you just pick one that is most appropriate for your patient and their visit as you're going to go and speak with them. Some of the questions that we have just standard through our emergency critical care template that we're going to be using for patients who are checking in typically through the ER are going to go over a lot of background information, and the very first part of that question for that template is going to be, what's bringing you in today? So just going through a few of our questions on this template. We start off with the primary complaint and history for your visit. So what's bringing you to visit us today? We go through and we take that kind of brief history. Typically at that point, I'll tell my clients, okay, great, so now we're going to go over a few more background questions just to kind of get the full picture here. The background questions that we have templated are current medications. So that template goes through, is your pet on any meds currently? Are they not on any medications at all? The next question on there is going to be vaccine status. So current on only a few different vaccines, unknown, maybe they've just got this animal. If they are current on everything, or if they are not vaccinated for a reason. Certain animals have been recommended by their veterinarians to not receive certain vaccines based on their history or their breed or species. We also are interested in their reproductive status, so if they are neutered or spayed, altered, etc. If you are working with a cat, we need to ask about the FELV or FIV status with similar options for your answers. So unknown, FIV negative, FELV positive, and FIV negative, FELV negative and FIV positive, FELV and FIV positive, or did not inquire. We also want to know what the housing or environment is for our patients that we're treating. So if this patient is indoor only, indoor, outdoor with supervised outdoor access, if they have unsupervised outdoor access, or if they live on farm property or out on a ranch and they have maybe a doggy door and they're not watched very closely when they're outside, or if they are only ever outside on a leash or in a very controlled setting. So we want to kind of get that background information too. We definitely need to be asking about any allergies or sensitivities that they know about their pet. Maybe their pet is allergic to chicken, so we need to be careful about what kind of treats they might be offered when they're in hospital. We should ask about what their regular diet is. So if this is a commercial brand kibble, if this is a raw food diet, something that they've cooked at home, maybe they just feed the animal whatever they're eating. if this is a canned food, if it's a prescription diet. All of those things are really important. Travel history is also very important to ask about. So typically we are asking, just as a general question, has your pet traveled out of our general, we're in Portland, Oregon. So generally, if your pet has traveled outside of the Portland metro area in the last 6 months, where have they been? You might be getting information about the pet going out to the coast or to a particular region where there might be some sort of a parasitic or viral boom going on. That can be really helpful. Maybe the patient has been just shipped up from a shelter scene in Texas or different areas in the country where they're going to be having different health problems that we should be aware of if this patient is now showing symptoms. I'm also really curious about previous medical history. So typically, this one can get kind of deep divey when you're talking to your clients, because a lot of clients are going to want to tell you everything that's ever happened to their pet that they're aware of, just so they know that you know everything that could possibly help us figure out what's going on. So I like to guide my clients a little bit with this. So I will ask them, hey, does your pet have any long-term medical conditions such as diabetes or Cushing's disease, heart disease? Has anybody ever said that he has a heart murmur? And so that's my personal phrasing that I use with clients that helps them figure out what exactly I'm asking about, because otherwise you're going to start hearing a lot of things about how he had worms when he was 8 weeks old, and that might be just a little bit too much for what your question is right now, but it might be really pertinent. So you gotta kind of dial these things in a little bit based on what the answers are and what the presenting complaint are for your clients. We always ask about any coughing or sneezing that our patient may have been exhibiting recently, so in the last couple weeks typically. And if the answer to either of those is yes, we dive a little bit deeper into the coughing and sneezing. What did it sound like? Are they producing mucus? Are the coughing fits happening exclusively after exercise? Anything like that. Next up is going to be vomiting. Has your patient been vomiting? If the answer is no, we move on pretty quickly. If the answer is yes, we need to dive in a little bit deeper. What is the quality of this vomiting? We should try to determine if this is a regurgitation or a true vomit. Or what are they bringing up? Is it foam? Is it only liquid and bile? Is it full meals? Are they throwing up foreign material or material that is a mystery to our clients? If the vomit contains any blood, that's also something we're interested in. If yes, it does contain blood, how much? Is it maybe just a couple little flecks because you've got some ulceration in the throat, maybe from repeated vomiting or something that they ate that kind of scraped on the way down? Or are they vomiting frank blood? Next thing we want to know about is going to be this animal's bathroom habits. So what kind of stools are they having? What kind of urination? Has everything been pretty normal? The owner's not noticing anything different? Or have those stools been soft, more frequent, less frequent, very firm? Does the patient seem to be exhibiting pain when they're trying to go potty? Is there a strange color to that output? That's something that we are very curious about. Definitely if there's any blood, and again, same kind of with the vomiting questions there, we would deep dive if the answer was yes about any blood, or if the owner is not sure if there's blood or not. We should definitely explore that a little bit more. And very similar questions with the urination. So has urination been totally normal, nothing out of the ordinary there, or is something off? If anything is off with any of that, we need to dive in deeper and figure it out. Now, after we have all of those things figured out there, we can, again, dive into any kind of visit-specific questions that might be related to that visit. After that, you always want to give your client an update of where they are in the flow of their visit, so letting them know anything that you can without making any promises as to really specific times, at least if you're in an ER. Probably won't ever be able to be super accurate on when exactly the doctor exam is going to happen. So you just want to be really careful about the timing, but you should definitely let the clients know where they are in their visit, such as the next steps being likely vital sign measurements for their patient, and then that they should expect to get an update from the care team and be reunited with their patient if that's true after the vital signs. All right, so we have a series of other templates that are available depending on what type of visit and patient we are seeing. Other types of kind of preloaded templates that we have that we can navigate through with our clients are going to be history for clients who are arriving for euthanasia only. So they've arrived at their decision that it's time for euthanasia, they've come to the hospital. We're really going to limit the types of questions that are being asked for that type of a visit. We have the exotics history template, which is greatly different than our general dog and cat template that's coming through. So just to go over the differences in that one, for exotics patients, we're going to be asking a lot about husbandry. That seems to be one of the biggest care issues that we see exotic patients for, is husbandry that's maybe not quite right for that species. It's a really tough one to get right for a lot of these animals. So we want to know about their housing, their environment. Is this a ferret that spends most of his time free in the house, or is this a chameleon that has a really, really strictly regulated environment that he lives in? So those questions are going to vary pretty widely depending on the species for any of those exotic patients. We need to know what those kiddos' diets are. If applicable, we need to be asking about temperature, humidity, lighting, what substrate the patients are housed in, any recent environmental changes, and then getting into some of those standard questions of previous medical history, any current medications, where was this animal obtained and when, and what the primary complaint for the visit is. For some of our return patients that we see for internal medicine or pain management, neurology, any of those services where the patients are going to be returning again and again, some of our post-checkup surgery patients, definitely, we have different types of templates for those that just go through a little bit more appropriate type questions for those patients and those visits. All right, well, thank you for joining us for an overview of how we take our histories here at DLEAH. If you have any questions about any of that or any tips of your own, don't hesitate to drop those in the comment section of the @Dev forum. Thank you.